Well, hello. Hello. My name is Jodi Scholes, and I am your instructor for the MBLEx review course. Today, we're going to be talking about the lower body. We're going to be doing anatomy. I know so many of you have said to me that you struggle with anatomy. Well, here's the good news. There's only 13 questions on anatomy on your MBLEx. So it's not going to be a ton of questions, not like business or laws or guidelines to a professional practice. That's going to be 30 questions on your MBLEx. So today we're going to be going over that anatomy. We're going to be going over the muscles, the bones, and some movements. Yay! 3 parts. So 3 parts to class today, and that is some test taking strategy. That's what we'll talk about first, so you truly understand how this MBLEx works. You actually have to know how to take this test. So that's the first thing we'll talk about. The second thing we'll talk about is lower body anatomy. We'll review some major muscles, some not so major muscles, the bones, and some movements. And then in the end, we're going to dissect some questions. And we're doing it a little differently today. I'm going to show you the lower body quiz. Yes, the quiz that is in the online learning center, so that if you are a patron at the $49 pledge level, you get access to 7 additional full-length classes and subject matter specific quizzes. So we're going to take a look at that quiz today because it's a beast, and I want you to see if you could tackle it. All right, we'll get at least a few questions done in that quiz. So let's move into the first part of class. The first part of class is about understanding what type of test is the MBLEx. The MBLEx is a computer adaptive test. So C.A.T, a computer adaptive test. So what is a computer adaptive test? It's a very specific type of test that you take at the testing center. Many of you have already experienced your first MBLEx, so you know what's kind of going on when you get to the testing center. But what you may not know is that this test adapts based on your answers. So you will get, when you're very first starting with the MBLEx, you will get a question that is of moderate difficulty, in between. So if we were using a scale of 0 to 10, it would be right in the middle, a 4 or a 5 in difficulty. If you answer that question correctly, your next question in that category will be a little bit more difficult. And you may be saying, what? What do you mean, more difficult? I answered it right. Yes, the test is going to adapt to your level of understanding. Your goal within the 1 hour and 50 minutes is to score 630 points. Every question is worth a different amount of points. So it's not 100 questions and 100 points. Every question is weighted differently depending on the degree of difficulty. This is what's called a computer adaptive test, a C.A.T. It's a C.A.T test. So your first question will be of moderate difficulty. If you answer it correctly, the next question will get a little harder. The next question in the same category. So today we're doing anatomy. Say you were to get your first question and it's about anatomy. When you answer that anatomy question correctly, the next question will get harder. If you answer that question incorrectly, the next question will get easier. It will adapt to test your understanding, your full understanding in the category of anatomy. That's why when you get results from your test, you will see if you did not pass the test, you will see borderline, low, you'll see high, you'll see a mark, high, borderline, low. And that tells you how you did in that category. Some practice exams will give you the same feedback. My practice exam does not. However, you'll know where you need to study. So you can look at that paper and have an idea. But the way that the test is scored, and let me tell you why this is actually to your advantage. You have an anatomy question. You answer it correctly. You get a harder question the next time. That harder question is actually worth more points. So when you answer more difficult questions, you get more points. Yeah. Now, likewise, if you answer questions that are easier, you get less points. And your goal is simply to score 630 points during this exam. But I wanted to share with you how the computer adaptive test works. This is how the MBLEx works. You may feel like it's getting harder when you take the test. It probably is because you're answering questions right. That's okay. We're not going to score 100% on this test. Get used to the idea. There's a couple of you out there who like perfect scores. You like to slay this test. Sure, passing it is actually slaying the test. Passing it is slaying the test. Because as soon as you pass this MBLEx, you can apply for a license in any state other than New York, Hawaii. I think that's it. Yeah, New York and Hawaii so far. They have their own tests. Now, let me also mention that other states, some states have their own test. You heard me mention New York and Hawaii. They have their own test. To practice in those states, you have to pass their test. But here's some good news. Texas just implemented their own test. If you live in Texas, you can take the MBLEx. You can also take the Texas test. Hear me. Go explore. Send me a message. If you want to take the test in Texas, you can take the MBLEx or you can take the Texas test. Right now, I'm strongly recommending that you go ahead and take that Texas test if you live in that state, because you can start practicing right away. You can start working. While you're working, you can continue to work with me, and we can work towards passing the MBLEx. All right, that's a little update on the world of massage therapy, the world of getting your license, the world that you're currently in, if you're listening to me, because you're in the process of becoming a licensed massage therapist. Time to move on to some learning. Here we are. So the musculoskeletal system, lower limb movements and muscles. I want to give a little shout out to Kareem. Kareem made some of these slides available through SlideShare, and I have used some of his images. This is what's called, when I give a thank you or a shout out to someone who's contributed to this presentation, that is called complying with copyright infringement. So I'm not saying this is my own production. I'm saying thank you to Kareem. she or he shared these slides publicly. And so I'm using some of Kareem's slides today. But that is something that, as a massage therapist, if you use other people's stuff, we have to give them credit. Otherwise, it's considered a copyright infringement. It's a little sidebar into some business, to some guidelines to a professional practice. If you decide you'd like to use something on your website, on a brochure, even on your business card, please make sure that it is free to use and that you have permission to use it. All right, here's what we're going to be covering today. We're going to be talking about the lower limbs. So we're also going to include in that, so upper limbs, right, is up here. Lower limbs is not just the lower leg, but we're going to be talking about movements and muscles of the hip. We're going to be talking about movement and muscles of the knee. And we're going to talk about movement and muscles of the ankle and the foot. Yay! I am going to be covering the major muscles, the muscles you'll probably need to know for the MBLEx. Look, nobody knows what's on the MBLEx. You know, you're like sworn to secrecy, like pinky swear and sign off on your firstborn child that you won't say a word about what's on the MBLEx. Fine, fine, fine. Nobody really knows what's on the MBLEx. But these are the major muscles you're going to want to know because of the MBLEx and because these are muscles you'll be treating when you're in your massage practice. So the lower limb consists of 4 major areas. So we're going to talk about the hips, we're going to talk about the thighs, we're going to talk about the legs, we're going to talk about the feet. I am getting a little notice here that my internet connection is unstable. I want to just remind you that if we break off, then please just rejoin the Zoom room and we'll start right from where we left off, just in case. All right. So 4 major parts, which include the hips, those 2 hip bones. I'm going to talk about the thighs, the bones, the muscles, the movements. I'm going to talk about the leg, the start of the top of the knee, the lower leg, and above the foot, so that tib, fib area, and then the foot. And the lower legs, the lower limbs, major function is to support the weight of the body, to connect us to the ground. It is a beautiful place to focus when you want to feel grounded again. So we tune into our feet when we want to feel grounded again. The lower limbs also help us with our balance, help us to stay upright, and to move in gravity when we're standing on our feet. Let's start with flexion. And so the movements and muscles of the hip. So the primary mover of hip flexion is the psoas. The iliacus psoas is the full name. And if you look here, we're talking about movements of this joint right here, where my little cursor is. So put your hands on your hip joint, right where that ball and socket is. You'll notice we're not talking about bending the knee. We're going to get to that in just a minute. We're going to focus on this flexion of the hip. Flexion of the hip, traditionally when we're looking at it, is done with a straight leg. And it's decreasing the angle right at the hip flexor. So the major mover, the major muscle that moves the hip into flexion, so straight out in front of you, like you're kicking a ball straight, right out in front of you, that muscle that's the major mover is the iliacus psoas. Sometimes we call it the psoas. And those two that work together, those muscles that work together, we're going to take a look at those, and that's the psoas and the iliacus. Now, if you hear me refer to the psoas, the full name of that is the iliacus psoas. You'll see that here, iliacus psoas. And so there's some other muscles that assist the psoas, but we're going to focus on that major muscle that moves the hip into flexion. Let's take a look at where this is. So the psoas is this muscle right here. This is kind of a big one to know. I don't think you're going to get asked about it per se on the MBLEx, but it's a major muscle. So just like you know the bicep and the tricep, just like you know the quadriceps and the hamstrings, just like you know rectus abdominis, those are considered major muscles, common muscles. A major muscle in the body is the psoas. And so if you did not learn this in massage school, you'll want to pay attention. So the psoas begins in the lumbar vertebrae. It starts in the lumbar vertebrae. It comes through the trunk, through our trunk, right here, and attaches to a bony landmark called the lesser trochanter. It might be a lot for one day, but I just want you to know the terminology. So here we are at the lumbar vertebrae. This is your last thoracic vertebrae right up here. That's your floating rib, rib number 12. So your floating rib. So L1, L2, L3, L4, L5, lumbar, 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 L. It attaches all along those lumbar vertebrae, comes through the trunk, and attaches on the inside of the femur at a location called the lesser trochanter. Now, will you be asked about origin and insertion? I hope not. But in case you do, here you have it. Now, this iliacus is this yummy muscle on the inside of your hip. So you may be able to just scoop around your hip. If you were to scoop your fingers around your hip bone, it's sometimes a little ticklish. That's your iliacus. And those two work together. They are synergistic, what we call synergistic. They work together, they support each other. And so the primary movers of hip flexion, when that femur comes forward, is your iliacus psoas. Technically together, the iliacus and the psoas. Here's a lovely picture of that with different colors. So this is the primary mover, again, is the role in swinging the leg forward during walking. And you'll see again, please note that this major muscle attaches to the inside of the femur, not the outside. We've got a bony landmark out here called the greater trochanter. If you are female, your hips kind of go out and then come in, right? The widest point of view, the widest point of females, the widest point of view is where those greater trochanter are. They're lateral, they're on the outside, greater trochanter, right here. You can see it on this one too, right there. Ooh, that's a nice picture, right? See, it's a bony landmark, boop, a little landmark, boop, bony. That is the greater trochanter, right there. But you'll see that psoas comes in and it attaches to this little bony landmark. And that's the lesser trochanter. Good. This is also, remember, Your sits muscles, I'm jumping to upper body for a second. So remember your SITS. So that represents your rotator cuffs, right? So your rotator cuffs, yes. And so in the SITS, supraspinatus, infraspinatus, teres minor, and subscapularis. One way you may want to think about the lesser trochanter is it's the same as teres minor, not teres major, not greater trochanter. Just like in the sits, it's teres minor. This is lesser trochanter. All right, let's keep going. Got lots of ground to cover today. Here's also some movements that, some muscles that contribute to the movement of the hip and thigh, but I want to recognize just the anatomy here. Let's take a look. Rectus femoris. So femoris, femur, the long bone of the leg, long bone in the upper leg is called the femur. Rectus femoris, also involved in that flexion of the hip, secondary. Take a look. Here's that long bone, that long muscle, sartorius. I believe that's the longest muscle in the body, sartorius. TFL, tensor fasciae latae. Did you learn about TFL? Look where it is. The IT band comes right up here. That's that white, and it turns into the TFL. So if you have hands-on hips, TFL is that soft spot right above the hip joint. After the hip joint, it turns into your IT band. But just above it is TFL, tensor fasciae latae. All right, let's move along to a few other, let's see. A few other muscles in hip joint movement. We're going to move from flexion. Okay, follow me here. Oop. So flexion. You know what, guys? I'm going to hide my image. I'm going to hide the video because I'm getting these little warnings. I think if I hide me in the video, it'll help with your connection. All right. So let's take a look here. On this far left, we have flexion. You can do that knee bend. We're talking just about the femur. This red line represents the femur and flexion. And you see that can be with a pointed toe or the knee can be bent, but we're still talking about flexion at this joint, at the hip joint. Hip, 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 hip joint, coxal joint, another word for the hip joint, coxal. And let's take a look. This is flexion going forward and extension when the leg comes back. So in this second image, you'll see here, little red line, backwards, heading back. Great. We're going to talk about these other movements in just a few minutes, but right now we're going to focus on flexion and extension. Try this one more time. All right. Flexion, forward. Extension, back. Major mover of extension, as you may have imagined, glute max and glute medius. Let's take a look at our next slide, though. So extension technically is posterior movement of the femur. It is initiated, it's activated by glute max. That big old chunk, a hunk of muscle in your bottom. And so secondary to movement, secondary muscles that move are, of course, your hamstrings. Glute medius is also going to be involved here, but the major mover in extension, just go ahead. If you're standing, if you can stand, stand. Bring your leg back like this model. Bring your femur posterior. Your femur posterior. You'll feel your glute kick in, and then your hamstrings assist. Here's a lovely look at the hamstrings. And I want to point out that you've got the semis back here, right? So there are 3 hamstrings. 1, 2, 3. 1, 2, 3. They come up here and they attach at your sit bones. Here's a question for you. In chat, right on here. Yay, Marna, I'm glad you're going to take the Texas test. Okay. Name of the sit bone. So the scientific name of the sit bones, it's right up here. In fact, feel them right now. You're sitting on them. The reason you care about them is because that's where the hamstrings attach. It's their origin. Now, I don't get into a lot of origin and insertions, and I encourage you not to either. It is way too much to try and understand exactly where every muscle starts and every muscle ends. As long as you know the general area, you will be able to eliminate 2 wrong answers, which is what we're going to do when we dissect questions today. When you go to take your MBLEx, you will be eliminating wrong answers. If you do not know the exact answer, if you feel like you don't know the exact answer, reread the question out loud, and then look at each answer and see which ones you know are not right. Yeah. And by then, you can narrow it down and find the best answer. It's a little less overwhelming. Okay, back to hamstrings. There are 3, semi. I like to say, do you imagine if you're driving a big semi-tractor trailer truck? Woo-hoo! Have you ever done this? Wah, wah, like tried to get the tractor trailer to honk its air horn? Did you do that when you were a kid? I did. That's the semi-tractor trailer truck, right? So when you see semitendinosus, semimembranosus, those are in the back. Semis are hauling a big load. I know this is crazy ways to remember things, but we got to find some way because otherwise we're just memorizing. So I like to think in images. And so the semis are in the back. Got a big hauling a big load. So your semis are in the back, and semis are your hamstrings. Yes, semitendinosus, semimembranosus, and then you got a bicep. You got a biceps femoris. So we think of the bicep right here, but what's the giveaway with biceps femoris? Yes, femoris, right? Yes, it's the femur, the bicep on the femur. Technically, this bicep is called biceps brachii. This is our brachial plexus. Biceps brachii. Biceps femoris in the back. Do we have an answer? Yes. Pumla, ischial tuberosity. Boom. Marna, I like where Marina, I like where you're going with that. It is an eye. It is attached to the ischium, but it's the ischial tuberosity. There's a nice bone there, a bony landmark, tuberosity, bone, yes. All right, let's move along. I want to just mention too that the hamstrings are involved in knee flexion. They have to contract. So they have to contract, so your knee is flexing, your hamstrings, right? Hamstrings get shorter, these muscles get shorter, they contract, and that also bends your knee. But when they contract, but they are involved in leg extension as well, secondary to glute maximus. Let's move along. All right. So let's look at abduction and adduction. Movements and muscles of the hip. Again, the coxal joint. This is an image of abduction. So you can do that in the horizontal plane, transverse plane, laying down, or you can do that standing up. Both are considered abduction. We're talking about the midline of the body. Typically, we're always going to be talking about anatomical position. Every now and then, you'll see something like this picture of the dude laying down, and that is not anatomical position. Anatomical position, thumbs out, standing feet forward. So even our little lady here, she has her hands on her hips. But typically, all movement questions that you will get on the MBLEx, you can start from anatomical position unless they say otherwise. Okay. But you can see this is abduction. This is abduction. Move this out of the way here. There we go. Okay. And so what muscles contribute to abduction? As you might have guessed, it's a glute muscle, but it's actually glute medius. Here's where glute medius is located. But the main hip adductors are glute medius here and glute minimus, because we're doing abduction. So our legs are going like this, right? You can still see the pictures here. Abduction, it's the more lateral group. So glute maximus is right here, that big old monster muscle, boom. Yeah, and that's going to be extension of the femur. Glute minimus and medius are going to be abduction of the femur. All right, and there's some secondary muscles. Let's see if okay, yeah. So TFL is a muscle. Might see it better here, yeah. TFL is a muscle that helps. Also helps with the piriformis. Look at where the piriformis is, by the way. Piriformis, you've heard of that muscle, right? It's a deeper muscle in the posterior compartment here. It's usually if we're dealing with piriformis, we're dealing with some type of sciatic pain. That's a big culprit of sciatic pain when the piriformis gets tight. Nice to work that with compressions or with an elbow, depends on your person. But let's look again at abduction. So we've got the TFL involved, the IT band, and just so you're familiar with these general areas. Now, one other condition, one other pathology I want to talk to you about is when these muscles are weakened, then if these muscles are not activating, then you can see here, it's very easy for those hips to be uneven. So if the glutes aren't firing, and we hear that sometimes with athletes, runners, cyclists, triathletes, they are doing exercises to fire their glutes, to fire up their glutes. But because we want to activate these glutes to get them working towards the goal, whether that's walking, running, cycling, whatever it is. So when those muscles are weakened, it's very easy for those hips to become unbalanced. And those muscles being the glute muscles. So when these glutes aren't firing, sometimes it causes an imbalance in the hips. All right. We didn't talk about adduction yet, but we will. We're going to look at medial and lateral rotation of the femur. What joint does the femur create? Proximal end of the femur, right? You got the proximal end over here. You've got the hip joint. So that creates the coxal joint or the hip joint, that big ball and socket joint that we talk about, right? So that big ball and socket joint is the femur. That proximal end of the hip is the proximal end of the, the proximal end of the femur is the hip. So as we look at medial and lateral rotation, we're going to be looking at medial and lateral rotation of the femur. It's not going to say the leg. It might. But if they are talking about medial rotation of the leg, they are talking about medial rotation of the femur. The knee will go in. The distal end, we've got the proximal end of the femur, making the ball and socket joint. You follow it down, the distal end of the femur is your knee. So if this whole bone turns medial, that is considered medial rotation. What will happen to the knee? What will happen to the ankle? What will happen to the foot? Yeah, it's going to turn in. Let's take a look. So now that you have that visual, here's what it looks like in a human being. Medial rotation, lateral rotation. See what happens to the knee? See what happens to the foot? Whoop. Good. Internal, sometimes also called internal rotation or external rotation of the lower leg. We are talking about of the lower leg. We're talking about lower leg. Of the lower limbs, we're talking about the femur. So when we talk about medial and lateral rotation of the lower limb, we're talking about the femur. All right, so there you go, just so you know. And this medial rotation, of course, is going to be your adductors, some of them. Hopefully you won't be asked about those muscles, but just so that you'll know the directions. Lateral rotation of the femur is a little complicated. Glute max is, again, most responsible. In this image is actually cut away. And again, this is lateral rotation, sometimes also called external rotation. We're not going to externally rotate too much. So there are 6 deep lateral rotators. You may have heard that before. All right, you ready to see them? Here you go. So we've got piriformis in here. That's a good thing to know. And then you've got these kind of weird ones all through here. And basically they're assisting with the lateral rotation or the external rotation of the femur. And these 6 muscles are also the stabilizers of the hip. They're either called deep lateral rotators or stabilizers of the hip. So let me say that again. Feel free to pause and take a look at all and pause these if you're listening to the video later. But these 6, now and then you do get asked about this. These 6 muscles are considered 6 deep lateral rotators or 6 stabilizers of the hip. And we treat them. You know, as massage therapists, we treat these when we do compression, when we use our elbow in the glutes. If you're skipping the glutes, you're a scaredy cat. Yeah, work the glutes, work it over the sheet, work it over the blanket, do some compressions. Man, we use our butt all day long. It does a lot of work. It extends our leg, it helps with walking. So get in there, do some compressions. And you know, of course, ask, you know, for informed consent if you feel like if you notice that your client is feeling uncomfortable with that, then don't do it. Ask for informed consent. Is it okay if I work in this area? Low back pain, big contributor are the glute maximus, medius, minimus, piriformis, and all of these lateral rotators. Just saying. All right, quick comic relief. What do you call a cow with 3 legs? Lean beef. What do you call a cow with no legs? Ground beef. Again, when I was a kid, we did all of these. You know, what do you call people with no legs? What do you call, you know, which was probably now inappropriate. But what do you call a cow with 3 legs? Lean beef. What do you call a cow with no legs? Ground beef, because they're on the ground. Yeah, okay. Let's take a look at movement of the knee, and that's going to be called flexion of the knee. Flexion of the knee is pretty simple. And we can only extend the knee from flexion. So we can't hyperextend our knee, right? So we only extend the knee from flexion. So basically the hamstrings are the reason for our knee. Let me move us out of the way. So our hamstrings contract to flex the knee. Now we're talking about flexion at the knee. This is so important, you guys. When you get a question on the MBLEx about movement, pause. Make sure you understand what joint they are talking about. Flexion and extension happens in the shoulder joint as well, right? Flexion is forward on the shoulder joint. Extension is back. This is not flexion of the shoulder joint. That's not flexion of the hip joint, is it? If the hip was doing this, this would be called adduction and abduction, right? Yes, that is what it is called here. Sometimes called lateral flexion, but mostly called abduction and adduction. Abduction, adduction, just like your legs. And flexion and extension. What we're most familiar with, right? Flexion at the elbow. This is not flexion of the shoulder. This is flexion at the elbow joint. Flexion, extension. Same thing with your knee. Flexion, extension. Flexion, extension. You can't most of us can't hyper extend our elbow. So from flexion, we have extension. From flexion, we have extension. Likewise with the knee. From flexion, we have extension. Flexion is created by the hamstrings. And we've already covered semitendinosus, semimembranosus, and biceps femoris. Let's look again at the knee. Extension. So, as you may have guessed, it's the quadricep muscles that are extending. Let me hide us. Let me do this. There we go. All right. There we go. Now you can see it all. Okay. So, as you may have guessed, it's the quadriceps, quad, 4, right? 4 quadriceps. I'm doing the number 4. Make a number 4 with your hand. 4 quadriceps. Yes. And so femoris, you see femoris, it's attached to the femur. So we've got our rectus. I'm going to give us image again, okay? Because we've got our rectus abdominis. Rectus is in the front. Rectus abdominis is in the front. Rectus femoris is in the front. And then we got our vastus brothers, right? Our vastus brothers. We've got vastus lateralis, vastus medialis, and vastus intermedialis. Yep, there we go. Intermedial, lateral, very straightforward, right? Vastus lateralis, vastus medialis, and then the intermedialis. The only weird one there is the rectus, right? Rectus femoris. 4 quad muscles make extension of the knee. Not extension of the femur. Remember, psoas, iliacus. A little confusing, but just when we talk about extension of the knee, then we're talking about our quads. We're talking about major movers. All right, home stretch here. Ankle, foot. Yay, home stretch. Okay, so movements of the ankle and foot. First of all, we have dorsiflexion, right? So dorsiflexion, taking your foot off the gas. Dorsiflexing, that little dorsal fin on the dolphin, right? The dorsal fin on the dolphin. The dorsal surface of our hand. The dorsal surface of our foot. Dorsiflexion. Dorsiflexion. So taking our foot off the gas. And the major mover in dorsiflexion, tibialis anterior. Go ahead, if it's safe to do so. Palpate the lateral side of your lower leg. Just, you don't have to do anything. Keep your feet flat on the ground for right now. Just touch the outsides of your lower leg. Now with one of your feet, bring your toes up. Take your foot off the gas. When you feel the movement of the muscle under your fingers, you have your hands on the tibialis anterior. So try it with the other foot. Flex. Shouldn't say that. Dorsiflex. Good. Relax. Dorsiflex. Relax. Find it with your fingers. It's on the lateral aspect, on the outside of your lower leg, about halfway down. Go ahead and try it one more time. Dorsiflex, relax. Toes off the gas, relax. Good. That's your tibialis anterior. We've got some minor dorsiflexin muscles, but I actually don't even care about them. There's another nice picture of the tibialis anterior. You know what is nice to know? Is take a look at these. Like you see these, extensor hallucis longus. This is actually the tendon that leads to your big toe. And it contributes. It's a little contributor to that dorsiflexion. So you've got the digits, the digitorum longus, hallucis longus. You know how the hallucis is your big toe? And then you got the digits down there that bring up, your foot as well. And a little bit of the fibularis, a little bit. The fibularis is also called the peroneals. So this is like more extension of your toes than it is dorsiflexion of your feet. So just so you know your regions, right? Hallucis longus, toe, hallucis. Yeah, those digitorum longus, fibularis, lower leg, foot. All right, let's come back. Here's plantar flexion. Plantar flexion, putting your foot on the gas. So for ballerinas, this could be considered true flexion at the ankle. You're pointing your toe. But, even in gym, we say point and flex, right? Point and flex. Don't do that. Don't do that for the MBLEx. You want to refer to dorsiflexion and plantar flexion. If you have some exercise background, some medical background, some ballet background, leave that at the door. We've got dorsiflexion and plantar flexion. Good. And the muscles that plantar flex, as you can imagine, both the gastroc and the soleus. It's worth mentioning that the gastroc goes over 2 joints. It's the only muscle in the body that goes over 2 joints, the gastroc. This big heart-shaped muscle, right? Boom, boom. It's a 2-joint muscle. You'll see here it attaches behind the knee to the head, to the distal end of the femur, and it tracks down, crosses over the ankle joint, becomes part of that soleus, part of that Achilles tendon, and attaches here at the calcaneus. So the 2 joints that the gastroc crosses, the knee and the ankle. Attachments at the distal end of the femur and the calcaneus. Pretty straightforward, actually. Just good to review. These are pictures of what the gastroc and the soleus look like. Gastroc has 2 heads, soleus 1. Soleus is deeper than the gastroc. It is under the gastroc. The last movements we'll cover are inversion and eversion of the foot. Inversion, turning that foot in. Eversion, turning that foot out. So you can see here, inversion, eversion, very similar muscles that are involved. So you're going to see tibialis anterior, you're going to see fibularis longus and brevis when it comes to eversion. So if they're on the lateral aspect of the leg, it's going to contribute to eversion. So even though tibialis anterior is on the lateral aspect of the leg, that does contribute because of where it attaches. See where it attaches on the medial aspect here. It does. That is the major mover of inversion. And then eversion are the fibularis muscles, also called the peroneals. Oh, see, there you go. Okay, so a quick summary. We've got flexion and extension of the femur. We've got abduction and adduction of the femur. We've got medial and lateral rotation of the femur. Pause, please. Remember, when you're getting a question about movement or muscles, it is essential that you know what region of the body you're in. If you don't know your regions of the body right now, go back to navigating the body. Find a video called Navigating the Body. We go over all the regions. The region is like the city. So say you were going to a baseball game, whatever your favorite sport is, basketball game, soccer game, football game. You're going to a sporting event. You know what city it's in. But then you've got to find the stadium. So you know what city the game is in. But you got to find the stadium. You got to get to the ballpark. That's what we're doing when we do muscles, bones, joints, movement. That question gives you the city you're in. You pretty much know the general region, but you got to get to the ballpark. You got to get in the ballpark to know exactly the best answer for your question. So we go from general to specific, but the regions of the body, once the question is not going to give you the region. It's going to give you the movement, maybe the body part. Coming back to that, that's anatomy. What we're talking about today, I kind of snuck in something on you. Anatomy, physiology, but also kinesiology. Kinesiology is movement. We've been talking quite a bit about that today. All right. So this is hip. This is knee. So we've got all these movements of the hip. The hip is the femur. The knee is the distal end of the femur. The hip, the proximal end. At the knee, we have flexion and extension, but only like we have it at the elbow. So flexion and extension. And then with our ankles and feet, we've got inversion and eversion. We've got dorsiflexion and plantar flexion. You know these. You've seen these before. How much time do you spend on the feet? How much time do you spend on the ankles? Hmm? Yeah. Do you just kind of brush over them? Spend a minute. It's where we touch the ground. It's where our weight hits the ground. It really feels good. When's the last time you had your feet massaged? Yeah, it helps. All right. Time to dissect some questions. Yay! All right, we're going to come back to this in just a moment. Today, we are dissecting questions that come from the Anatomy of the Lower Body quiz in our online learning center. Bonus content for you guys. When you log in to your online learning center, you will see something called kinesiology, anatomy. You'll see anatomy of the lower body, and you'll see different elements on your dashboard. So elements are the components, the elements of your class. You've got a video marked by this little black arrow, well, white arrow in the black box. You've got a video, which will go through all the different things I just went through about the lower body. You've got a little video on the varus and valgus test of the ankle. I prefer the knee, but we have an ankle. And then kinesiology, this is the quiz, this little check mark. This box is the quiz. And so we're going to open that quiz and we're going to do a few questions. So let me go ahead and open the quiz. This is what the quiz is going to look like when you get started. Ready to go? All right. So I'm going to draw on, you'll see we got 25 questions here. This is number 1 of 25, but we're just going to do 3 questions today. 3. We talked about the lower body. We didn't talk too much about the pelvis, but let's take a look. What structure does the ischium and the pubic ramus come to form together? Now, this is a demonstration also on how you can go through and just take the quiz, or you can go through and take a look and see what the actual answers are. You can open a new tab, type in the question, or just say, structure, ischium, pubic ramus. The ischium is your hip bones. Pubic ramus is that little section that attaches to the symphysis. So the symphysis is in the middle, but the structure of the ischium and the pubic ramus come together to form something that's a circle. It's that circle at the bottom of your pelvis. I'm not sure if you can see the whole question. Oh, we got some answers coming in. Yes! Letitia says the obturator foramen. It is correct. Trish, letter D, correct. It is the obturator foramen. So during your quiz, you'll select an answer, you'll submit the question, and then you will see some feedback on your answer. Let's do 2 more. Woo, this is a good one. You ready? What muscles make up the quadricep? All right, I'm waiting for all of you because we covered this. Quad muscles. Which ones? We talked about how many quad muscles are there? There are 4. So your answer will need to have 4. answers. I think all of these do. Mm-hmm. Mm-hmm. Can you eliminate a wrong answer? Look at letter A. What's wrong with that answer? Mm-hmm. Mm-hmm. Ooh, I see some answers coming in. Good, good, good. Yes, that's exactly what's wrong with letter A, Trish. TFL is not a quad. Look at you guys. Yay. Yes, the correct answer, letter B. Tensa fasciata is not part of the quads. Blanca, you got a comment? Or Trish, who is that having a comment? I think someone had a comment. Gracilis is not a quad. It's part of the front of the leg, for sure. But it's not part of the quadricep group. And there we go again, gracilis. And an adductor is in the medial section. So during your quiz, you'll pick the best answer, hit submit. Yes, nice work. Let's do one more. Oh, let's skip this one. All right, we won't skip it. We didn't talk about it today, but we won't skip it. The blank ligament in the ankle would be tested in a valgus stress test. You may want to watch that video. You may want to watch the video that is the valgus and varus stress test of the ankle. And so the deltoid ligament is on the inside. The lateral ligament is on the outside. Varus. I'm going to just take a 50-50 guess. I know it's not posterior tib. I know it's not calcaneofibular. I know it's either deltoid or lateral, but every now and then I get mixed up on the varus and valgus. But here's the nice thing. You got a 50-50 chance. If you know the varus and valgus test the medial and lateral side of the ankle, then you just pick the ligaments that are there. Posterior talofibular, no. Calcaneal. It's on the calcaneus, right? No. All right, so I'm going to go with lateral because that's the most common sprain is a lateral sprain. Let's see. Oh, got it wrong. What ligament is on the medial aspect of the ankle? Can we go back and pick it? Deltoid. Dar. Okay, but that's what happens. Okay, we got time for one more. Oh boy. Another valgus test. So now we know valgus because our last one was also valgus, and that's medial, right? So we just, valgus test is medial. When assessing the tibiofemoral joint, all right, in your chats, yeah, thank you for those answers, Blanca and Pumla. We had to take a nice guess, right? And let's see, I picked C, which was not right. Blanca, I think you got it right with the medial, the deltoid ligament. All right, here in the chat. Where is, tell me the femoral tibial joint. What's the common name of the tibiofemoral joint? Look at what you see here. Tibia, femur. It's a fancy way to say what? Oh, close, Letitia. Look at it again. Tibiofemoral. We've got a femur and we've got a tibia. What do those come together to make? Where's your femur? Touch it. Follow it. Thank you. Rico, yes. Letitia, yeah. Oh, close, close. Puma, yes. Letitia, yes. There you go, right? Careful, careful. Because we see tibia and we go, boom, ankle. Got to be the ankle. Well, the tibia has two ends. the distal and the proximal. So in assessing the knee joint, how would a valgus stress test be executed? So we're testing the medial aspect of the knee. Which A, B, C, or D tests the medial aspect of the knee? Here's another example. So say you didn't know the valgus test. We can say, what does a valgus test, what does a valgus knee test look? Let's just put that in. So you didn't know ahead of time it was the medial collateral ligament. Now you know, okay, let me see if I can answer now. A, B, C, or D? How are we testing it? So if we're going to test the medial ligament, we're going to put pressure on it, right? We're going to push against it. A, B, C, or D? Can we eliminate one of these? Let's look at A. Put pressure on the medial part of the knee to test the LCL. Lateral collateral ligament. Nope. Put pressure on the medial part of the ankle. Ooh, to test the what? Put pressure on the lateral part of the knee, pushing in to test the MCL. Put pressure on the lateral part of the ankle to test the deltoid ligament. All right, you guys. Oh. What are we testing in the valgus test? What are we testing? The valgus test is also known as the medial stress test. So we're assessing the integrity of the assessing the integrity of the MCL, the medial collateral ligament. Does test A test the LCL? You see how C, where it says test the MCL? Yeah, I know. Careful how it's worded, because we had 1, 2, 3, 4. We had 4 answers. That said, oh, test the LCL. Valgus test tests the medial ligament, whether it's the ankle or the knee. Good. So that's going to be C. Yes, that was a tough one, right? Okay, let's see. We'll do one more because that was kind of a wonker. Okay, here's a good one to end on. The correct name. Oop, I don't think that's okay. So the correct name of the ASIS. Just put it in the chat. A, B, C, or T. A, B, C, or D. The ASIS. Can you eliminate one right away? Can we eliminate A right away? We can eliminate A right away because AIIS. Let's see. Boom shakalaka. Yes. Good. Letitia, yes. Arbert, I will tell you momentarily how to take the practice tests. Trish, yes. Puma, yes. Marina, yes. Good. Oh, there we go. Yes. Arbert, yes. Rico, yes. Exactly. Boom. Y'all told me to pick letter D. Bang. Yes. Good work, you guys. Okay, that was a sample of the lower body quiz in our online learning center. A little bit different than what we normally do, but wanted to give you a sample of how that looks and to remind you that there are quizzes. Yes, and some of you are a little reluctant to take these quizzes. So listen to the material and then take the quiz. Just like the practice exam, you'll need to pass the quiz with a 70% or better. Otherwise, you can take it again. You can take it again until you pass with a 70, and then if you want to take it again, just let me know and I'll clear your scores. Same thing happens with the practice exams. Once you pass that practice exam with a 70, I need to clear the score, and then you can take the practice test again. You can take as many practice exams as you want. And this just depends on your pledge level. If you're at the $12 pledge level, welcome. I'm so glad you're here. You're listening to the live classes and you're getting access to all the recordings. At the $20 pledge level, you get unlimited practice exams. Reminder, if you pass it, you need to let me know. I get a notification, but sometimes I miss them. So just let me know you're ready to take your next practice exam if it doesn't show up on your dashboard. But at the $49 level, you get access to all the classes at that $49 pledge level. 7 subject matter specific classes, 7 subject matter specific quizzes. So it's the 1-2 punch, with the practice exam and the quizzes. So all right. Thanks for spending some time with me today. I'm going to stay on, take a little extra time with the students who are here in class. I am so glad to be with you, so glad to review this information with you on your journey to becoming a licensed massage therapist. I'll see you again real soon.